Well, in healthcare, most of the people are talking about how do we take a system that really focuses on just treating people after they're sick and injured or have some type of disease and completely transforming it into a system that focuses on wellness. To really build a healthcare system that's a well care system, not just a sick care system. And making that transformation, while it sounds perhaps easy to do, is not. All the financial incentives in the system work against building a well system. The delivery system is not there to really provide the infrastructure for wellness. And health insurance benefits in particular are not designed to promote it. So a simple concept, but it is fundamental. But going from A to B to do that is going to take a lot of work. I'd really focus on 4 reforms. One is we've got to get the cost of healthcare down. And one way to do that is really focusing on this explosion of obesity in the country among kids, adolescents, and adults. About 30% of the growth in healthcare spending over the last 20 years is due to the doubling of obesity. And so we have to find ways to prevent the rise in childhood obesity, obesity among adults and seniors. That means we're going to have to attack this in multiple settings: schools, communities, at the workplace, and how we structure incentives in health insurance. So that'd be the first area. Second is that about 3/4 of what we spend on healthcare is linked to people with chronic disease: diabetes, high blood pressure, bad cholesterol, pulmonary disease, arthritis, asthma, and you can go down the list. We don't do a good job of working with patients to help them manage those conditions. And we have a lot of bad statistics that prove the point. In the Medicare program, 20% of people who go into the hospital are readmitted into the hospital within 30 days. And that's just an artifact that we don't have a management system working with patients outside of a physician's office or the hospital. So part 2 is that we really need to build a delivery system infrastructure that allows us to work with patients, largely through primary care and nurse practitioners, to do a better job of managing chronic illness. The third thing I'd focus on is reducing the administrative costs of our healthcare system. It's too complicated. There's too much paper. It costs too much money to administer. This is a problem for physicians, hospitals, and patients. So if we could find a way to streamline the system to make it simpler, physicians could spend more time with their patients doing clinical work and less time filling out forms that really don't add much in terms of value to healthcare in the system. And finally, we've got to find a way to cover everybody. We have 47 million Americans who don't have health insurance in this country. It is a politically difficult issue to figure out. The Congress is debating this right now. And the tough thing about it is to figure out how do you pay for it and who pays for it. I'm hoping that this time around we can come to some consensus on this. We tried this 15 years ago and it ended in a stalemate. Nothing happened, and the dilemma is all the problems have gotten worse over the past 15 years. Costs are escalating, we have more and more uninsured, and so on. So I'm hoping that everybody recognizes this time that we need to compromise. Everybody's got to give up something. Nobody's going to get their first choice. The second choice can't be the status quo. It's got to really be a recognition that to solve this problem, we're really going to have to work collectively together to do it. I would give it a 75–80% chance, and for several reasons. The main protagonists that really scuttled healthcare reform last time, the pharmaceutical industry, the health insurers, the drug and device manufacturers, all of them have come together to work with the White House, including the hospitals and the physicians, and basically come out and supported a universal coverage proposal that would require all Americans to have health insurance. That's revolutionary. That is a major sea change in terms of where we were compared to 15 years ago. The second part of it is that I think everybody understands in the Congress what a key priority this issue is to Senator Kennedy. And we all know that Senator Kennedy is suffering from a very bad form of cancer. But this is a man that is active in the debate. It would be his lifetime work to get health care coverage for all Americans. He's made it his main goal in the United States Congress for several decades now, and he is devoted to getting this passed. So I think those two issues combined with the focus that President Obama has on the issue, he's said that this is his major domestic priority, So I think we'll find a way to get this done. It may be messy. It may not be what everybody wants to have completed in one swoop, but I think we'll pass something very substantial, hopefully by the end of this year. I think the European models have the most relevance because they have a great focus on primary care. We don't have a focus on primary care in this country. We have a focus on tertiary, very sophisticated care. The way the European countries built their healthcare systems is they started from the bottom up, primary care, and then moving towards the top until they ran out of money. So they've got a tremendous primary care infrastructure. They have all the technological tools that we have. It's just that they don't have them in every hospital in those countries. We did it just the opposite. We started from the top down, have a very technologically sophisticated healthcare system, but no primary care infrastructure. And the problem that that faces is that our healthcare measures, infant mortality rates, longevity, just basic public health measures are nowhere near as good as the European countries, despite the fact that we spend twice as much per person on healthcare in this country than the Europeans do. So I think there's a lot to learn about how do you build a primary care infrastructure that really focuses on primary prevention, preventing disease, and really keeping people healthy. Well, the first place to start, I think, is a Medicare program. That is a program that spends about $400 billion a year, and it is really not designed to effectively keep people healthy. And so one of the low-hanging fruits is how do you build prevention into that program? How do we do a better job of working with patients who are seniors to keep them out of the hospital and out of the physician's office? And a lot of that is just common sense work with nurse practitioners working with patients at home, social workers helping patients out with other types of healthcare needs. Now, this isn't a thing that we could do very quickly. We could do it very inexpensively, and there's bipartisan support to do it. So my sense is on healthcare reform is that we need to start places where there's mutual agreement. We can build bipartisan support. It's just common sense to build a capacity to work with patients once they leave the physician's office. Ironically, that doesn't happen today. You have an 80-year-old woman with diabetes and high blood pressure and bad cholesterol and back problems, and they get a care plan from their physician. They go home, and really you're on your own. There's really no benefit out there to help you maintain and monitor what's going on. So we need to fix that, and I think that's an area that we could do very quickly. Well, first of all, we got to recognize that it's a priority. We spend less than 3% of our healthcare dollar on prevention. Everything else is on treatment. The irony is that we will not pay for somebody to exercise or stay on the right diet or have their blood pressure checked. But if you don't take care of yourself and you don't monitor your blood pressure levels and blood sugar levels, and you get something happen with your legs, and you get an amputation, we'll pay for that. And with diabetes is a great example. Diabetic amputations are the #2 source of amputations in this country. Most of it's preventable, but we won't pay for it. So we've got to switch things around. We've got to pay for prevention in how we design health insurance. We have to find ways to pay for prevention at the workplace, to try to work with employees who want to change their behavior. We give them the tools to do it. We've got to build it into schools. We don't teach this anymore in terms of just basic nutrition, diet, and exercise. It's been replaced and crowded out by a variety of other initiatives. So if we don't start with the schools, by the time they get out of school, we've already lost 10, 15 years. So we have to make it a priority, and we have to fund it, and we need to fund it in a variety of settings: schools, the communities, workplace, and we need to change the whole structure of how we do health insurance to really focus on paying for prevention and paying for wellness, and not just focusing on paying for things that happen if we don't take care of ourselves. I think that the industries like the pharmaceutical industry and the hospital industry and the drug and device industry have a role to play, but I don't think it can be unfettered. Certainly if they come in and play an educational role about new drugs, new innovations that are appropriately, I think, counterbalanced in terms of the pros and cons by others who really understand what the trade-offs are, then I think that that's a positive way to go. I think that the problem is that oftentimes you get money involved in this in terms of incentives for making prescriptions and incentives for using particular types of drugs, and those types of things are problematic. But purely on an educational standpoint, to provide information, as long as it's appropriately counterbalanced, what are the pros and cons, what are the other treatment options, what does it cost, what are the improvements and healthcare outcomes expected with it. Information is good, and I think that we should welcome the industry to come in to do it, but it's got to be done, I think, in a broader context of what are the pros and cons of different ways of treating patients.